I just sat on a stick. Okay, why am I sitting here? Why am I dressed in fancy clothing? Why is there a lovely river streaming by me? Well, there's no real reason for any of this, except I just like it out here because it's nice. In this video, I'm going to give 3 stories. One story is from the nursery with a newborn, and another 2 stories are from an outpatient office. So that's with normal kids, kind of from newborn to 18 years old. I think everyone's familiar with their pediatrician's office. Story number 1. Day number 2 on my pediatric rotation. So I'm in the nursery, and the nursery has newborns. And I'm with this attending physician. The attending physician, I'm walking around the attending physician, and they say, okay, come look at this baby, look at this baby. So the first baby I look at, first of all, these newborn babies are tiny. I've seen like little babies, but I've never seen babies that are just really, really tiny. Anyway, okay. So she's like, come and look at this baby with me. And I'm like, okay, I'll come look at this baby. So, you know, I've got my scrubs on, and I'm going to see this baby. I feel a little bit confident from my past OBGYN rotation. Now, as soon as I look at this baby, it starts crying. The baby starts crying. She starts crying immediately. And the attending physician is talking to the mom, and she's like, okay, Zach, go look at the baby. So I'm looking down at this pile of, I don't know what the hell's going on. Tiny, tiny, tiny baby. You know, it looks like a normal baby. So I take my stethoscope, which is the size of this baby's head, and I just put it on the chest, and I try to listen to something. And I can't. First of all, I can't hear anything because the baby's breathing so fast, the heart's going so fast, I don't know what's going on. So the attending physician says, how does baby sound? I say, fine. I think fine. Here's the great part. And the attending physician comes over and says, Zach, do you notice anything interesting about this baby? And I say, it's really small. It's a small baby. She's like, well, it's a newborn baby, Zach. They're all pretty small. -1 for Zach. And the next part is about -30 for Zach. So she says, do you notice anything about the color of this baby? And I say, yeah, it's you know, red. It's like a pinkish baby, you know. It looks maybe a little bit pale. And she's like, Zach, I'm standing on the other side of the room, and I can tell this baby is jaundiced. I knew this baby was jaundiced as soon as I walked in. I have no idea. I don't know what a jaundiced baby looks like. I hear yellow. I know icteric sclera, you know, yellow eyes and yellow baby. I'm expecting some, you know, Big Bird, Teletubby kind of yellow. Well, it's not that kind of yellow. She says, yeah, I can tell from over here. She comes over to look. She's like, the baby's head is shows me about a bilirubin level of like 20. The baby's chest is maybe 15, and then around 10 to 5 below. And I'm like, oh, okay. It looked like a normal baby to me. So that's -30 for Zach, and I'm sitting at -31, and I will fail my pediatric rotation. Story number 2 is one of the really cool stories, or I think it was really cool stories, because you know everyone goes to a pediatrician's office, right? And I always thought, like, wouldn't it be cool to be the person who's actually like getting this information, who's learning to tell whether this kid is like sick or nothing, right? So what happens on this pediatric rotation is I'll follow someone for a day, and the attending physician says kind of, okay, Zach, I'm really busy with this. Just go into that room and kind of check on this patient. She's sick. I think she has croup. She's about 8 years old. And I was like, what the? So this is what happens. We're both standing outside the room. She just let me know that I'm going to be taking a history and physical on my own with no help. She's going to be standing outside the room checking another patient. So I'm going to be on my own doing a history and physical with an 8-year-old child who's a girl who has no idea who I am, and also the mom, who I'm more worried about. The mom's going to be like, what are you sticking me with this medical student who doesn't know anything? So we're standing outside of the room. She just told me that I'm going to be doing the history and physical on this kid with croupy-like cough, and I just freeze. I literally just freeze standing outside of the room, and she opens the door, and I remember her starting to say, hi, Mrs. XYZ, this is Zach. Zach is a medical student, and I do not hear anything past that, because I'm still standing in the frame of the doorway, and the only thing that I'm thinking is, okay, what is croup? Is this person gonna die? I remember something about racemic epinephrine. What if this child, 8-year-old kid, needs racemic epinephrine? Do I go get it? Do I call the ER? Do I find the doctor? What do I do? How do I know if it's croup? How do I put an otoscope in someone's ear without perforating their eardrum? How do I talk to people? Do I talk to the parent? Do I talk to the kid? All this is keep in mind, I'm still standing in the frickin' doorway. The attending physician is still introducing me. And I'm just blanking. There's nothing going in my head. There's no information going in my head. And the next thing I know, the attending physician says, okay, Zach, come here, sit in the computer, log in, do everything, and kind of get to it. So the attending physician walks out of the room. She literally just she doesn't push me, but she just puts her hand on my back and like gives me a little nudge. To just go sit in the room. So I'm sitting in the room. I'm just staring at mom and kid. And what I do to buy time, and I think this is what you learn, I think starting is the hardest part. Just starting is really the hardest part. So I buy time and I say, oh, computers, they're really tough. I don't know what to do. Mom's staring at me like this. The kid's just like, and I'm just like, computers, what are they, who the computer systems, tough, right? And mom's just like, she hasn't said a word yet. She's just staring at me like, okay, my kid's gonna die. What are we doing here? And I'm start logging into the computer. And then I just start talking to the kid because I think she's more on the intellectual level of me than the mom at this point. And I asked the kid, I just asked the kid, I say, hey, how's it going? How are you doing? And the kid says, you know, I've been coughing for a couple days. It was hard to sleep last night. I woke up in the middle of the night coughing, and it hurt when I cough. And I say, okay, and I'm logging into the computer at this point. I'm starting the history. And then suddenly it just starts happening. I just start talking to them. I'm like, so when did this cough start? Did you have a fever? Does it hurt to breathe? Do you have any history of asthma? Tell me all the medications you're taking. Do you have any allergies? Do you have any family history of this? Has this happened before? Did anything make it better or worse? Have you had trouble breathing? Did they take your pulse ox? Oh, let me check your pulse ox because this is in the vitals. Okay, your pulse ox looks okay. Have you been eating? Have you had any bowel and bladder movement issues? And I just kind of start spouting off these questions. Mom is looking a little more comfy. I'm feeling a little more comfy. And I'm in it. And it's so cool. So I'm like, okay, I'm going to make up her name. The 8-year-old girl's name was Carly. I say, okay, Carly, why don't you step up on the exam table? Let's take a seat on the exam table and we'll see what's going on. The first thing I do is I take out my stethoscope because everyone knows for some reason that when you take out your stethoscope and you put it in your ears, you can't really do any talking. Even though you can really, right? But everyone's like, oh, we have to let the doctor or the medical student or nurse or whatever listen properly so they don't talk. So I take that out and I just put it on the chest. I'm not even listening at this point, but I'm thinking, okay, what are the next things I'm gonna do? Okay, I'm listening to the chest right now. And then I'm probably gonna have to look down their throat to see what's going on, see if there's red, see how the tonsils look, maybe look at the molars and look at kind of around the teeth and gums area to see if anything fishy is going on there. And then I'll probably wanna look in the ears, kind of see how the tympanic membrane is looking. Maybe it'll be a little red or puffy if it's an ear infection with pus behind it, but probably not. Okay, then I'm gonna wanna probably look up their nose, look in the nostrils to see how that's going. Okay, then I'm probably going to put that away, maybe look at their eyes with the flashlight just to kind of see if the pupillary reflex and neuro, everything's doing okay. Okay, and then maybe I'll want to feel some lymph nodes, some anterior cervical lymph nodes, kind of behind the ear lymph nodes, and other lymph nodes, just kind of to see what's going on. Okay, then what do I need to do after that? Okay, well then I probably need to lay her down so I can do an abdominal exam, just palpate kind of to see how everything is. I probably want to listen to the chest again and the heart because it kind of changes when you lay them down. Will I want to do anything else? Maybe I'll sit her back up and check her knees. So that's like 60 seconds and my thing's still in the heart. I'm like, okay, man, now I'll probably listen. So I start to listen. The heart sounds fine. The lungs sound fine. And then I'm like, okay, lean forward. And I palpate. I listen to the back, both parts of the lungs all the way up and down. I'm like, maybe I hear a little wheezing on the left side, maybe. But I'm like, that's not really the upper airway thing I might expect or be worried about with croup and stridor, right? Because with croup and stridor, it's kind of this narrowing of the upper airway, which creates that characteristic kind of tough breathing and also that weird like seal bark like cough. I didn't hear any of this while this was happening, by the way. Midway through, I'm doing this and the attending physician comes in and she's like, okay, Zach, tell me what's going on. And now this is when my confidence goes right to the bottom of the ground again because I'm like, oh, soap. What is a soap? What is a soap? I used soap this morning. I think soap. So for those of you who don't know, soap is how you present patients. So it's like subjective, objective, assessment, and plan. So you have to say, okay, what did the patient say? And then you have to say, okay, what did I see? And then you have to say, okay, what do I think is going on here? And then you say for the plan, okay, how am I going to treat this thing? How am I going to solve this kind of issue that this person's having? So it turns out this girl had sinusitis. She didn't have croup at all. She just had sinusitis. And I kind of didn't see, the ears looked fine, but she had this kind of congestion congestion going on for a while. So the doctor said, okay, listen, you have sinusitis. We'll give you this medication because you've had it for over 10 days, etc., 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 and you'll feel better. It's hard to explain how cool it is because if you've wanted to do this for a while, so my pediatrician is one of the reasons I went into medicine, and he was just this really, really cool guy. And he found things really well. And I remember thinking, wow, this guy makes me feel so comfortable. He makes me feel excited to come to the doctor. What if I could be that person? What if I could be that person that's excited to go to the doctor, that makes kids excited to go to the doctor, makes them comfortable, makes them have like a fun time when they go to the doctor's office. So all this is kind of going through my head. I'm like, this is cool. And this was different than my experience in the OBGYN rotation and the nursery rotation, because in the OBGYN rotation, it's usually kind of things are happening very quickly and you don't really get time to get to know someone, to talk to someone. In the nursery, they're just little balls of something. They don't really make any intelligible remarks or anything like that. I tell jokes, the babies, they don't get it. They usually poop, that's it, and that's the exciting part. But anyway, the kids, like once you start, in my personal opinion, once you start to hit like 4, 5, 6 years old, in my recent, very limited 2-week experience, you can start to actually talk to the kids and you can say, listen, what's going on? How's school going? How are grades? Was this past year tough because you couldn't go into school? Was Zoom class hard? And just, you're able to talk to kids and like get to know them. And that's a really cool thing. So another story I had, this is a really, really quick one, but I just wanted to say it because it was funny. So this kid, again, this is when I'm taking history and physicals on my own, which is awesome, but still nerve-wracking. So how it goes is I knock on the door, I'm like, hey, my name is Zach, I'm a medical student, Dr. So-and-so was really busy, so they wanted me to come in and kind of take a quick history and physical, see what's going on, and then I'll report back to him. But don't worry, he'll come in, the doctor will come in and make sure and double check everything that I saw to make sure I'm not missing anything, and also because he's the more trained and knows a ton more than me to kind of help your kid out, right? Came in because he had some kind of malaise, he was feeling kind of very tired and nauseous, and he just was feeling icky, right? And he was feeling icky for a couple weeks. And I go in, the first thing I notice is the ear is pointing a little bit more forward. So anyway, I'm talking, and I go to look at the ear, and I see this huge red thing around the ear. Like it almost looks like a third of his head on the right side is just a red rash on the right side around the ear. So my mind immediately goes to, does this kid have meningitis? Does this kid have mastoiditis? Does this kid have a brain abscess? All these things are just things that I'm thinking about are like behind the ear or into the ear. Because if you start to get an infection that goes kind of behind the ear canal and all that kind of stuff, the kid can be really, really sick. So I'm freaking out. I actually freaked out so much when I saw this. I was like, oh, let me step on for a little. And I actually took the doctor out from another room. I'm like, listen, I think this kid, is he going to die soon? What's going on? The doctor's like, okay, don't worry about it. Let's go look at it. He comes in and he's like, Zach, you need to calm down. You know what this is? I've seen 6 of these this week. So you know what this is? Do you know where we are right now? We're in we're on the East Coast. What do kids do in the summertime on the East Coast? They go play in the forest and, you know what I mean, in the grass and things like that. What lives in the grass? And I'm like, rabbits eat grass. No, they eat carrots. And he's like, no, Zach. What is tinier that live in the grass? And I'm like, ticks. So it turns out this kid had Lyme disease. And I thought I'd see the bullseye rash, but he's like, no, it doesn't necessarily present that way. This kid had Lyme disease. He had a huge rash on his head from the Lyme disease, and he was starting to get the initial symptoms of kind of the second stage of Lyme disease, which is like, or the first stage of Lyme disease, which is like these cold and junky-like symptoms. But we caught it early enough, I think, to give him medication. He's going to be completely fine. But I just thought that was funny because I was ready to send this kid to the ER. I was ready to get a spinal tap. I was ready to start IV antibiotics and fluids. I was ready to just go freaking crazy with this kid. And he's like, Zach, you need to calm down. And it's good I didn't say anything, and it's good I didn't counsel the parents or the kids, because who knows what I would have said, and they would have been like, Zach, it's the end of the world. But yeah, that was just a quick story I wanted to say because I thought it was funny. And that was that. And then today, which is kind of one of the reasons I wanted to come down and make this video, is because they let me just take histories and physicals of well childs, histories and physicals of sick childs, all on my own. I was typing up all the notes all on my own. I was talking to parents, talking to kids, all on my own. It was really, really cool. I was like, wow, this is like, I don't know. For some reason, when you're in the patient seat, you think, okay, these doctors and people must have some magical knowledge. And I guess we do, right? But now I'm in this spot, I realize, listen, I don't really know what's going on. I'm just asking a ton of questions to kind of get a brief understanding of what's going on. And then maybe while you're talking to me, I'll look something up or check your past history or often look something up and see, okay, this is what's actually going on here, and this is how we treat it. Anyway, so I'm talking to all these kids and everything's going well. And then what the best part is, I'm getting better at history and physicals and presenting patients, because I'll type up the notes and everything during it. And then usually what the attending physician or the person kind of managing the patients will do is just say, okay, Zach, I agree with you. And they'll just write this little attestation on the bottom of the note, say, agree with what the medical student said. And that feels pretty good, right? Because this is what the doctors do day in and day out. And if they agree with what you're saying enough to attest it and say, listen, we're going to follow the treatment that you're doing, that feels good. That means like you're at, I mean, no way I'm on the level, because they did some edits and they talked to me about certain things and they double check things. But to be able to be doing this as a third-year medical student is amazing. I'm amazed by the amount of trust they give to us. In the past 4 weeks on my pediatric rotation, I mean, I've held like probably 30 completely newborn babies who have no idea what's going on. The mom just gave birth to this precious thing, right? And I'm the one that they're giving so much trust in to be able to carry and hold. Amazing. I've been taking physicals and histories on kids. I've written assessments and plans. People say that you forget these kind of feelings, right, when you go back and you keep going through medicine. But for some reason, I feel like I'll never lose this feeling, but it's a feeling I guess I want to record, because it's just like, it's such a cool, fun feeling. It's a cool, fun feeling to be able to knock on a door and say like, hey, my name is Zach, I'm a medical student, I'm gonna take care and maybe help your kid or child with this health problem they're having and make them feel better. And you're trusting me to do an exam on this kid and to help this kid that basically is your entire life. One of the doctors told me something which I think is a pretty good quote, and he's like, listen, once you have, I mean, I don't have any kids, so I don't know this, but he says, once you have a kid, your heart is walking outside of your body. And I think that's pretty much true. You can see kind of the care and almost nervousness these parents have for their kids, because they're their life, right? But if you made it to the end of this video, thank you so much for watching, and I will see you on the next one.